Hi folks, it's time for the second video. This is probably the most important video of the Heartburn Reversal course. So if you've read this far, you know that I believe that certain dietary triggers, certain things that people do and ingest themselves are why we have heartburn. Some people think there's a lot of other reasons, like, oh, my family has it, or it's genetic, or whatever. I don't really believe that's the case. Most of the time, my clinical experience is that people are doing something to themselves that is actually causing their digestive tract to have trouble. So, on that note, the things I'm going to suggest are dietary for the most part. Do these things first. If you don't do these things, you're going to continue having heartburn. If you don't like that symptom or you don't like the long term consequences of it, like erosions in your stomach, like ulcers, like esophageal cancer, this is what happens to people who have heartburn over a very long period of time. And we already talked about how taking medicines for that isn't always a good thing. If you're taking medicines, you're decreasing your body's ability to absorb minerals and nutrients. Therefore, you're going to get osteoporosis and all these other complications of taking a medicine. So I want to make sure that we're on the same page. I want you to try these things as an elimination. Now, most doctors, most medical doctors like myself will recommend the following, and I'm going to add a few things towards the end that'll be a little bit different than you might normally expect. The first of these is to avoid foods and chemicals that cause heartburn traditionally. These are spicy or acidic foods, alcohol, chocolate, caffeine, nicotine, fried or greasy foods, artificial sweeteners, processed sugar, and fast food. Let's start with, I'm going to hit a few of these as high points. The first one is alcohol. Alcohol definitely aggravates heartburn. Now, I get a lot of people in my 20 years of experience where they'll come in and say something like, "Well, I don't drink alcohol, I only drink beer." Please, please, alcohol, anything that has alcohol in it is alcohol. Okay, so beer is alcohol, wine is alcohol, um, liquor is alcohol. In my clinical experience, alcohol causes a large percentage of the heartburn and more serious problems like gastritis, ulcers, and peptic ulcer problems, things like that. Occasional alcohol usually doesn't cause persistent digestive issues, but a person who drinks alcohol daily or multiple times in a week can definitely trigger heartburn in average folks. This doesn't mean that you have to swear off alcohol completely. I'm not telling you that. But if you want to cure or prevent having recurrent troublesome heartburn, you have to consider at least a trial being off of alcohol and see if it gets better. I have many times just told someone, take a 4 to 6 week trial where you don't drink at all. See if you like how you feel. A lot of times these patients will sleep better, they have better energy, better mood, and their heartburn miraculously goes away 3 or 4 days after they stop drinking alcohol. Alcohol can cause irritation directly to the lining of the stomach, and it also irritates the stomach because of sugar and corn and wheat, which many people have allergies to, which is a really advanced topic, and I'll probably hold for a more in-depth course should people be interested in that type of thing on food sensitivities. Alcohol also affects the liver, and the liver directly affects digestion. The liver also helps processing medications and all kinds of things. There's a lot of secondary effects, such as heartburn, that can occur with alcohol use. So, again, I suggest a minimum 3 to 4 weeks being free completely of alcohol. If this helps, great. At least you know why you have heartburn. At least you realize you don't have a Prilosec deficiency. Okay, you need to stop drinking alcohol very consistently, and therefore your digestion will improve and you'll have better health. Or you can say, well, I know it causes heartburn, but I'm going to go ahead and have an alcoholic beverage every once in a while and only take an antacid occasionally. I recommend that the earlier comment, not the latter, but people can make their own choice on that. So another thing that is really key is to avoid chocolate. Chocolate has theophylline in it, which is very similar to caffeine, and we'll get to caffeine. Both theophylline and caffeine cause changes in how the digestive tract works, and they definitely cause heartburn. And a lot of people will tell me, well, I only drink coffee, or only have chocolate occasionally, or I only have it once a day in the morning, and I get heartburn at night. It's related to that. Caffeine can stay in the body a long time. Theophylline can stay in the body a long time. Even if you journal, even if you love chocolate, try journaling the times you've had chocolate and when you have heartburn. You might find, curiously, that they are linked together. Um, Let me go ahead and highlight caffeine again as well, because that's another really, really big one. Caffeine is one of the most common drugs that humans take. It comes in tea, it comes in sodas, it comes in coffee, and other energy drinks and things like that. Please stop them, okay? If you have heartburn, remember, we're talking about heartburn. If you're having heartburn or chronic reflux, or you've had to take medicines for years for heartburn, you need to give yourself a chance to be off of caffeine completely. Switch to decaf. Yes, you might have headaches for 2 or 3 days, but then when that's done, you probably won't have heartburn anymore. You'll sleep better, have better energy, all these kind of things. Those are key. Um, Also, I think it's important in a basic video like this where we're trying to just outline the core things that cause heartburn. Be careful with NSAIDs. These are medications. NSAIDs are Advil, Aleve, Motrin, Naprosyn, even things like Celebrex, Mobic. These kind of medicines are, of course, anti-inflammatories, and they can definitely cause irritation in the lining of the stomach, and they can lead to ulcers. Um, Also, there's a class of drug called bisphosphonates. These are drugs like Fosamax and Boniva, typically used for bone density. These medicines definitely can cause digestive issues. Lastly, things that slow the digestive tract, like narcotics, pain relievers like codeine, oxycodone, and fentanyl, which have their own host of medical issues associated with them. Of course, these are also can cause heartburn and digestive issues, and you'll have to work with your doctor to get off of those if need be. So I hit the really high points, but I want to really outline the really key ones one more time. Spicy, fried foods, things like that. Alcohol. If you drink alcohol and you have heartburn, please stop drinking alcohol and give it a try for 3 to 4 weeks and see if you don't have heartburn anymore. The third, probably most common, is caffeine. That comes in sodas, tea, coffee, monster drinks. I've already told you lots of times, if you're a patient of mine or if you've seen any videos I do, sodas are death in a can. Caffeine's just one of the reasons they're bad for you. Tea and coffee are very, very common beverages. You can drink decaf. I drink decaf in the morning. I switched from caffeine years ago, and quite frankly, I don't notice any difference. Works just fine for me. It's nice, it's hot, it's a habit in the morning, and I don't have to have side effects of caffeine. Monster drinks, quite frankly, are just bad for you. Nicotine. I didn't hit nicotine, so let me add that one in. I'll slip that in. If you're a smoker or use chewing tobacco, it is possible that that's causing reflux. Nicotine is very similar to caffeine in its action in the body. So if you've eliminated everything else, you are struggling with smoking or nicotine, just be aware that could be your culprit. I mentioned fried or greasy foods. I mentioned chocolate because it has theophylline in it. Processed sugar and fast food. These are chemically laden foods. I'm kind of throwing these in at the very end. These are not good for you. Ideally, you want to be eating vegetables, good fats, and I've got whole videos on that. You can look that up on the nrgtribe.com under good fats. And you should be eating proteins like meat, things like that. That's ideal. That's a good diet for people, and it avoids foods that typically are going to cause heartburn. So I hope this has been helpful for you. Again, I'm suggesting that if you do these dietary changes, if you will be, no one knows but you. And if you will do this and you will say, I'm going to eliminate these for the next 3 to 4 weeks, these foods, and I'll list them in the outline. I want you to try that for 3 to 4 weeks. And if you do that and you have no heartburn, you know that it's curable for you. You know that you don't have a more serious problem because it got better. Disclaimer. Remember I already gave you the idiot disclaimer. This is not medical advice. This is general medical information based on how I've treated my patients for years. This program does not replace the need for medical advice in your specific situation, especially if you have blood in your stools, serious abdominal pain, or you just don't get better with some basic dietary eliminations. This program is for informational purposes only. I hope this has been helpful, and I hope the outline has been helpful for you. Please leave a comment or leave a review for us. I'd love to hear from you. If there's anything you'd like me to add or comment on, please send me a message, and I'd be happy to review that with you. Take care, and I hope this really helps with your heartburn situation.